You're live now, Councillor Aitken.
Cool, thank you, Aidan. Hi, everybody who's watching this at home. Welcome to another virtual Kings Norton Ward Forum. We should probably hope that it's the last one that we're going to do virtually, but we never know. I think we last spoke around about November, so I just want to say that I hope everybody had a good Christmas, and I hope that you're all keeping well and safe. And that you're looking forward to the roadmap out of lockdown as and when it comes. Just to start off with the usual housekeeping parts of the agenda. This is to advise residents listening / participating in the online meeting that a recording of the meeting will be available for future record. I believe that if you want to watch this back, or if you want to send to your neighbours or friends in the area who want to watch it back, it's just the same link that you clicked to join. I believe. So we'll just get straight into the body of the meeting then. So next on the agenda is the COVID-19 update, and we've got Julia Duke-Macrae with us, who is a public health consultant, and she'll be with us to give us a kind of latest update and answer any questions or concerns that we might have. If you haven't been on one of these Teams meetings before, you should see an option where you can post some comments into the Q&A. I will keep looking at these and we'll pick them out as they come in after Julia has given her update. So hello, Julia, are you okay to just kick off and give us a bit of an update?
Yeah, can you hear me?
You're a bit quiet for me. I don't know if that's the same for everybody else.
Can you hear me?
That's better, yes.
Okay. Thank you for having me, Councillor. Regarding the updates, you would be happy to know that the case rates have continued to decline. We've had a decrease from a week ago by 12% overall in Birmingham.
Excuse me, Julia, it's very difficult to hear to you. Can you please come close to the mic?
Okay, I will.
Thank you very much.
Right. So we've had a decline. We've continuously had a decline in the case rates across Birmingham. The hospital admission rates are coming down, so are the death rates, which is a good thing. Now, specifically to the north, I'll call it the north, I mean the King's Norton North, so I'll just call it north. The north case rate is 76.25 for 100,000, and that ranks to 28th out of 69. Now, the south is 53.05 case rate per 100,000, and then ranks to 46 out of 69. Now, in terms of the age group, the highest proportion is seen in the 20 to 39-year-old, and about 44% of those cases in that age group. You will be glad to know that there are much lower cases in the 80 and over. So you have about 2% in the north and just 1% in the south. Now, for the 20 to 39-year-olds, you have about 38% of case rates in that group. In terms of ethnicity, the highest proportion is seen among the white ethnic group. You have in the north 67%, and in the south, in the south you have 67%, and in the north 73%. Now there are over we have quite a lot of COVID champions now, a total number of 779.
Sorry to interrupt. We've just, somebody else has said in the Q&A that they can't hear.
Okay.
So yeah, sorry, if we could try and.
I'll have to scream a lot more.
Thanks. Sorry about that.
So I was saying that the COVID champions, we have a total of 779 now, and a lot of the councillors are involved at the moment. They regularly receive updates of the number of cases and rates, and they also have updates in terms of the latest guidelines, which they're able to share with the community. And that is really important because that allows them to provide that information to their community. And it's important for councillors to sign up. So in terms of the North, there are currently 7 COVID champions, and in the South, 5. So it would be really good if you can, more of you can sign up. Now, in terms of contact tracing, we now have a lot of the LFD testing going across the whole of Birmingham. So, and now currently the businesses being asked to register and encouraged to register so that their staff do not have to self-isolate. So a lot of that is going on across Birmingham. Now the vaccines are going on well. Update is really good, but we still have a slight low uptake among the COVID risk groups. And we see that there are lower uptake among the more deprived areas compared with the affluent areas. That's about it. I'm happy to take any questions anyone would have. Sorry for the slight microphone problems with my laptop.
No, that's absolutely fine. Thank you. Yeah, if you do have any COVID or vaccine or lockdown related questions, then please do get them in the chat. I have a couple that I will ask just to kick off. You talked about the rates coming down, which is very, very good. I had a quick scan the other day, and I believe that this might have been the previous week actually, that Kings Norton North was the best ward in the city outside of Sutton. So if you're in Kings Norton North watching this, well done. Thank you for all following the guidelines. That's really, really great to hear. My question is just about as of just a few days ago now, we entered the sort of the roadmap out of lockdown. How concerned are you at all about seeing a potential increase in cases moving forward, or should the vaccinations sort of prevent that from happening? I'm particularly thinking here about schools having just gone back, as they were one of the biggest sort of transmitters of the virus last time around, that led to the previous lockdown, and obviously almost all of school children won't yet have been vaccinated. So I'm wondering if you've got any concerns about that, like I say, if there is any at all.
Well, the programs in place to ensure that the students going to school are tested twice in the school and 1 at home, and also the parents and relatives in that in their homes are also encouraged to collect their testing kits and do the testing in the community sites. So if we do have any such case or incidents, there are people on ground to do contact tracing and stop the transmission of COVID disease itself. So there are things on ground. I'm not worried at this stage because there are things on ground to stop the transmission of cases.
Good, that's really good to hear. Obviously, with the vaccination rollout does just give everything that buffer that didn't exist last time. I think there were a lot of concerns last time the lockdown was lifted, that it was too early, that we obviously didn't have a working vaccine then. So that is obviously much more positive to hear. Just following on from that, we've got a question in the Q&A from Ian Bell, who has asked what is known about how transmission is occurring locally. So is that through households, schools, workplaces? Obviously, with the long lockdown that we've just had, that felt very long, the cases have come down. Do we know much about what the sort of the main transmission of the virus is at the moment?
Most of it is through household transmission, and a few of it in healthcare, but that's declining severely, and in shopping centres as well. That is also declining. So those are the areas that we've had a transmission thing. Yeah,
that's really interesting. Obviously, it is just a case of the more that the less interaction that people have with each other, obviously, the better.
Yeah.
we just to come back, someone has asked in the chat, when you say north and south, is that Kings Norton? Yes, I believe
Yes,
so.
it is. Sorry, I made that easy for myself. Sorry.
Yeah, no, that's absolutely fine. It's weird that there are some parts of Kings Norton North that are more south than Kings Norton South, but there we are. That's the name. Yeah, so we said about the vaccine uptake again. Also in Kings Norton North has been very high. So thank you to everybody who has got the vaccine so far. I had my vaccine a couple of weeks ago, as I'm in priority group 6, and I'd barely sat down before I was then jabbed and then sat in the waiting room. It was so quick and so efficient, and like, again, just to put on record that the NHS staff and the council staff and everybody that's been working on this is really doing a fantastic job. Are there any sort of areas that there are concerns about the vaccine uptake, in that, or is it generally just going well? Is uptake higher than was expected? Is it lower, or is it about where we expected it to be?
You mean in terms of your ward, or generally?
Just generally, I think
The uptake has been pretty good, but more could be done around the 60 to 64-year-old, and also the COVID at-risk group. So there's a slightly lower uptake there in that group, and then we've seen in some communities where you have the ethnic groups. You've seen a low uptake amongst the Muslims, for example, and also some other faith groups as well. So, but there are currently work going on around tailoring messages to meet local needs in terms of translating what the messages are saying in languages that people can understand. And so that piece of work is going on, working around with the faith leaders to encourage people in their communities to take up the vaccine. Yeah,
that sounds really positive. I know I've been involved in a kind of a body of work where some politicians from across the city have been trying to do that, and trying to sort of bust some of the myths that have existed around on the vaccine in some communities. Just one thing that you said then about how the uptake is lower in the at-risk category. That was one thing I noticed when I looked at the data the other day. Do you know or have any sort of hypotheses on why that is? Because there is quite a significant difference between like the age groups, like sort of 85s, 80s, 75s plus. The vaccine uptake is very good. When it's broken down into the people who are just at the at-risk category, it does seem quite considerably lower yet, and I've just been sort of struggling to work out why that is.
What I mean, because this is NHS led, it is what has been relayed to us. I think one of the things they mentioned was that a lot of the people within this group are scared, and they think they may be badly affected by the vaccine. So the primary care network, then the administrative groups phone them up, and where they haven't actually done, they're followed up by a practice, the practice actually phoning them up and talking to them about their concern, and that they've seen actually following that kind of interventions, they've seen an increase. They've seen an increase in terms of uptake. So that work is still going on. The NHS is doing a lot of work around those groups.
Yeah, no, that's really good, and again, positive to hear. The only other question from me then is, it's something that I have been quite surprised hasn't been picked up on quite as much in the last few weeks. I think everybody's obviously got caught up in the euphoria of the roadmap and is sort of like dreaming of finally being able to go out and see friends again and get haircuts. But there was a couple of comments that have been made in the national press conferences about how some additional restrictions might be needed after that, like sort of post-June. Just through your sort of own expertise and knowledge, how likely do you think that is, or is there sort of too many variables at play at the moment? Because obviously the transmission of the virus is much worse in the winter time, sort of for obvious reasons. Do you think that there is potential for more restrictions, or at least sort of more cause to be concerned around as we get closer to winter again, or do you think that 21st of June is?
Well, I simply think there are two ways to look at this. Take the vaccines if you call, and keep on with the staying safe as much as you can, because that is crucial. I mean, there is no guarantee that you won't transmit the disease after having the vaccine. So the key thing is to remain safe. So wash your hands regularly, wear your face masks and keep your distance. I mean, when we do that and obey all the rules, we're not likely to have an upsurge. But if we think that by disregarding the rules and just taking the vaccine that is going to work, nobody can predict anything. We just need to just follow up with the instructions we're given and see where we go from there.
Okay, that's great. Thank you. There is a couple of other comments and questions. Is the recent issue raised in other country about the AstraZeneca vaccine being raised by people in Birmingham? That is a very, very good question. Thank you, Carmel. And then she's also asked another question about how there's been an increase in Kings Norton North from 4 in period 27th of the 2nd to the 5th of March to 9. Whilst these numbers are low, is it a cause for concern, or is that so? Is there a correlation there, or is that just a sort of one of those hovering up and down?
Just one of those hovering. Actually, the numbers there was a slight increase, but it's nothing significant. Okay. Now, in relation to what you said earlier on, in terms of the AstraZeneca, there's been, a recent information from the European regulators who have now said it is safe. WHO said it was, they didn't have any concern about it, and even our MHRA, which is the medical healthcare regulatory body, said there was nothing wrong with our vaccine. So I think that has now been confirmed. The European regulators have said it's okay and safe. So I don't think anyone needs to worry. But when you think about having COVID and ending up in hospital, and the likelihood of you developing clots as well, I think the risk of having the vaccine is much lower than actually coming down with the disease. And the vaccine itself is safe. It will decrease your risk of having admissions in hospital and also the risk of dying from COVID. So when you compare both, I think, it's safe to have the vaccine and be sure that at least you will be prevented from having been admitted in hospital or dying from COVID itself.
Yeah, no, that's true. And I think it's one of those things that there were a lot of concerns about the vaccine when it sort of first came onto the scene. I know that some people that I know had concerns about how long it took to create the vaccine, without obviously looking into it, that it was, in terms of person hours and research hours, it worked out exactly the same as every other vaccine, was tested on the same number of people as every other vaccine, but obviously it was done much quicker because almost every research and development department and scientist in the world was kind of focusing on that. But now I think we're at the point where everybody knows someone now, at least, or knows a good fair number of people who have been vaccinated and who have had very sort of mild at worst side effects. I know for me, I just had a bit of a sore arm for 24 hours and then was absolutely fine. So Peter Griffiths is specifically a question asking how many second vaccinations have been given and when is this program expected to be rolled out more locally? Do we have? I'm guessing we are slowly starting the second round now.
Yes,
Can you
slowly
more insight on that?
Yeah, you're correct.
Do you know? Do we have that data to hand? Sorry, for how many have had the second?
No, I don't have that. I won't have the latest update, but I'm quite happy to share that with you.
Yeah, that would be great. Thank you.
When I do get it. at least the most up-to-date one.
Yeah, that's brilliant. Thank you. There's also a comment in the chat from Ian Bell, who said that 80% efficacy and 80% take-up would still leave 36% susceptible to a third wave, so may still be a possibility. I think that was in reference to my comments earlier about further restrictions as we move into the winter. There's another comment there from Marie Hall, who said COVID may well have an impact on turnout in the forthcoming elections for mayor. Is there going to be publicity around postal voting? I mean, I will gladly put on record here now that if you don't have a postal vote, please do consider getting one, because not only does it mean you don't have to go to the polling station, it also means that if you get hit with a text from NHS the day before polling day that you have to self-isolate because you've come into contact with someone, then you won't be able to vote. Whereas if you've got a postal vote, you certainly will, and you've got an extra sort of 2, 3, 4 week period to get that vote in. So if you're watching this at home and don't have a postal vote but want to vote in the mayoral and police and crime commissioner elections in May, please do consider getting a postal vote. It's very quick, it's very easy, it'll take you just 2 minutes, and you can be safe in the knowledge that you have got your vote in weeks before polling day. I know that loads of people are a traditionalist, and it took people ages to convince me to get a postal vote because I liked going down and putting my X in the box and voting. But yeah, I would get a postal vote this time round. It's more important than ever. But yeah, the council, as those elections get closer, the council will be publishing further guidance on voting and campaigning and the elections more generally. I believe the latest guidance was that we should be expected to bring our own pens or pencils. So that's something to be aware of as well. Yes, so just check. I don't think there are any other comments or questions right now. So thank you so much, Julia, for joining us today. Unless you've got anything else to add to any of the other comments or.
No, just what if you're invited to have a vaccine, go and get it.
Yes, definitely. Just the requests there are, when you're invited to get the vaccine, go and get it. Until then, and also afterwards, please continue to follow the guidelines to the best of your ability. Make sure that you're keeping not just yourself safe, but also your loved ones, your friends, your family, your colleagues. And final point on that actually is that for those of you who don't know, there is a lateral flow test centre now on our doorstep. It's at Oddingley Hall, which is right next to Westheath Park. I went there to get a test a couple of weeks ago, and again was very quick, very easy, had the results within half an hour. So if you're currently working in a job, for example, where you aren't able to work from home, please do consider getting a lateral flow test as often as you possibly can. They are free to get, and like I said, take a very, very short amount of time. So I think that is all on that. So thank you for joining us, Julia. It's really great to have your insight. And hopefully soon we won't need you on these calls because COVID will be a thing of the past.
We hope so.
Yes.
Thank you.
Well, thank you. Thanks, Julia.
Bye.
Bye. If anybody does think of any sort of further questions or comments that they want to make on that, please do post them in the Q&A function or in the chat, and I will make sure that they are asked after the meeting, or you can always email me and I will make sure that your questions are asked. If not by Julia, then someone else in the Public Health Directorate. So moving on to the next item on the agenda, which is Rednal Road safety issues. Now, there are a couple of things from me before I move on to Sajid Khan, who has very, very helpfully joined us today. He's the local engineering manager for the Northfield constituency and other constituencies, I think. So is a very, very busy man. So thank you for joining us today. But there are a few things that I want to kind of highlight first. I know just how big of an issue this is to people who live not just on Rednal Road, but around Rednal Road, and people who use it, like me, who live around the corner and use it very regularly. it can be incredibly dangerous for the people who live nearby. It can be dangerous for the motorists and for the pedestrians alike. And there have been a number of accidents or incidents in the past sort of 12 to 18 months. And I know that there are, sorry, that's my phone ringing, that there are huge concerns about it. Initially, what I'd wanted to do was have some of the officers who are overseeing a body of work on including Rednal Road in a local road safety scheme. I wanted them to join us today, not necessarily to report back to people on the work they've done, but more to sort of listen to you and read some of the comments that come in so they can sort of address your concerns and listen to your views when they do this body of work. But unfortunately, they did not join us tonight. So I'm going to hand over to Sajid, who may want to give us a bit more of an update. Again, if you have any comments or questions about Rednal Road, please do get them in the chat. And if Sajid is unable to answer them tonight, well, I can make sure they are answered by the officers who are overseeing the work on Rednal Road. I should probably highlight that actually, that if you're not already aware, there is a body of work going on Rednal Road to make it more safe after some kind of incessant lobbying on my part and local residents' part. So this is really great news, and I thank Sajid for joining us. And if you want to come in and provide an update, Sajid, that would be fantastic.
Good evening, everybody. Rednal Road, a local safety scheme for Rednal Road has been identified based on accident collision frequency. Our criteria for identification of a road for a local safety scheme is 9 or more accidents in a period of 3 years. So based on collision data, this road has been identified for a possible road safety scheme. The project manager for this, who's developing the proposal for Rednal Road scheme, she is Rachel Rock, and unfortunately, due to current COVID-19 situations, because to develop a road safety scheme, she will have to go on site, take some measurements, and analyze the accident, find out causes of those accidents, find out the common factors behind those accidents, and then identify remedial measures or the safety measures which will be more suitable for the considering the geometry of the road, considering the type of accident on that road. So there's a lot of work which is required to be done on for the development of any road safety scheme. However, because of these current COVID situation, she wasn't able to develop the scheme, so that's why she wasn't able to join us today. But hopefully, as soon as there's some relaxation in COVID restrictions, she would be able to go take some measurement, prepare some design for us, and she would be able to let us update us on what sort of measure will be suitable for that road. I think also you're on mute.
Yep, it was bound to happen at some point.
You were talking to yourself?
Yeah, that's not a first. Just so thank you for that, Sajid. Thank you for coming in Rachel's place, despite you not being the main kind of overseer of the project. But in your professional opinion, what do you think that this safety scheme could look like? Like, what are the kind of options on the table here? Because I know that I've been sent emails with loads of suggestions from the people who kind of know the road best because they live on it. And some of those suggestions include anything from speed cameras to speed bumps to making it a 20-mile-an-hour zone. What do you think that it could look like further down the line, or what would your recommendations be as the local highways manager?
Traffic speed cameras we are not installing anymore. because of some enforcement issues, and we are unable to install more. But considering the road layout and the road geometry and type of accidents, when I submitted the program entry proposals for this Rednal road safety scheme, because we have to submit our proposal and try to secure some funding for the road. So at that time, I suggested that cushions will be the best way forward for that road at that time. And with traffic speed cushions, it will be more effective than simply introducing 20 mph limit, or even more effective than fixed cameras, because the problem with fixed camera is they are very good only to the extent of that 50 meter, 100 meter stretch where we got those, which is the coverage area of the camera. As soon as drivers crosses that area with white crosses, they try to speed up. So that's why we're not putting any more fixed cameras. On main roads, some like big roads, we have stop, instead of going for fixed camera, we are moving toward average speed cameras, which are more effective because it covers bigger stretch. But however, Rednal Road is not a main road, so for road like this, in my opinion, traffic speed cushions will be more effective.
Yeah, that's great. And just to clarify, speed cushions are a form of speed bump, aren't they? I think they're kind of wider and a little bit flatter than.
Speed cushions got the same height as that of humps, but the only difference is they got gaps between them. So our emergency services on bus routes, etc., we can only put cushions. If it is a bus route, then we have to reduce the height of cushions because new buses are relatively lower compared with old ones. So we go for 65 mm high cushions, whereas if it's not a bus route, then we can go for 75 mm. But the cushions are with a gap, and the gap helps emergency services to stand around those cushions, so they can travel without compromising their response time.
No, that sounds really helpful. Thank you. It's good to get that clarity, or at least have an image of what it could look like. There are a couple of comments in the Q&A which are very fair questions, which is about the areas of Rednal Road that this is going to cover. Obviously, Rednal Road goes everything down from Kings Norton Green, pretty much up to West Heath Island. So, are there any sort of specific areas?
I think it will be covering the entire road, not just a specific area. Although the concentration of accidents are at junctions, but the scheme covers the total road. But however, when they will be conducting the detailed accident analysis and study, then the designer will be able to identify which area is more requires more attention, which doesn't. But at the moment, the scheme covers the entire stretch.
Yeah, okay, that's really good to hear. I think there were some concerns that it was going to be a very small stretch, where there are kind of issues at different points of it, with it being so large. I know that a section of the road that I've run into problems before are just going towards the green as it starts to go downhill. People can race down there. Someone has said, won't cushions cause people who now travel at speed to drive between the gaps? I think that's a very good point. There'll have to be a kind of a measurement on how big the gap is in between where possible, because sometimes you see it all the time of when there are a cushion on each side of the road. If there's a large enough gap in the middle, someone drives into the middle of the road, which in itself can also be quite dangerous if there is some oncoming traffic that wasn't previously noticed. Is that something that you think might be an issue?
considering the width of road, I think instead of 3 cushions, we may have to go for 2 sets of cushion in Rednal Road. I mean, although it's a very fair point, sometimes drivers are able to drive through the gap, but still, even to focus on such a zigzag road, it's not a straight road. To aim for the gap, what you have to do is slow down, and that's what we want. We don't want to break cars. We want them to slow down. And when somebody try to aim for a gap, and considering the height, they have to slow down, and that's what we want.
Yeah, there is again just going to put a few of the comments back, publish those. So Ian Bell has asked, what is the time frame for these improvements? This is something that I would appreciate some clarity on where possible, is that these things can sometimes feel like they can get kicked into the long grass, and that's my concern about how long it's taken already. Obviously, I appreciate that there has been a lockdown, but as someone has pointed out, the number of accidents seems to be, if not increasing, because there has been less traffic on the road with the lockdown. There are still does seem as though there's a massively disproportionate number of accidents, and I think there are concerned about how many accidents could take place before this body of work is carried out. And again, appreciate that you're not the person in charge of this this project, so you might not have the answer, but what would you believe the time frame would be for this? How long would this take to put in?
Last time when we had meeting, I think last meeting was on 24th of November 2020, and at that time we were hoping that some proposals will be ready by now in Feb, but unfortunately nobody can predict how long this lockdown will go and how quickly we will be able to back and work normally. So, I mean, we want this to be implemented ASAP, but it is a sort of time. I mean, we last predicted that we will be able to bring something in Feb. We couldn't do that. So it is a uncertain time, and it's very hard to say anything like Rachel will be able to bring some scheme in, say June, etc. I mean, if the situation improves, she may be able to start consultation before that, but that depends on when she will be able to travel, take measurements, and conduct site visits. So it's a bit difficult time, but we want it to be implemented ASAP.
Yeah, that's yeah, I think the frustration here is, and I think there have been a couple of comments in the chat about this, in that people have still who work in other sectors have been expected to go to work, and obviously a lot of this work would take place outside. But what I will do is I will speak to some of the other officers and try and get a bit more of a time scale on this and try and push for these works to be carried out as soon as possible. I'm just going to read out a couple of the comments as well that's in the chat. Someone said that you might say it's not a main road, but the traffic has increased and is busy at all times. Would these cushions not be best combined with the 20-mile-an-hour speed limit? Someone said children walk in groups from the nursery to the green. It should have a 20-mile-an-hour. This is what the residents need. And then another comment here is, we have lived on Rednal Road since 1984. Over this time, we've seen accidents outside our house on several occasions, some more serious than others. Emerging from our drive is particularly hazardous, as vehicles coming up the hill from Grange Hill Road are often driven at such speed that there is not enough time to turn safely. To cross the road, which we do every day to walk our dogs, is even more dangerous for the same reason. Walking down the road towards Grange Hill Road, as there is a narrow footpath on only one side of the road, is intimidating, especially with large vehicles often being driven at high speed within inches of the pedestrians. Reducing speed on Rednal Road to safe levels will certainly improve our security and well-being, and I certainly second the end of that comment. I'm sorry if I missed this, and it might be provide some clarity. Were you saying that the cushions would be in place of a 20-mile-an-hour speed limit, or would they be combined with? Because I appreciate that the cushions would. do a great job and people would have to slow down anyway, but would it not be better to make it a 20-mile-an-hour zone? Because that seems like the kind of thing that, you might correct me if I'm wrong, again, you are the expert here, but reverting that to a 20-mile-an-hour zone would require minimal work, would it not?
The main issue is, I mean, if like we can identify scheme with cushions, 20 mph can be delivered as a part of the scheme, so it's not expensive. If like Rachel decide to go for cushion with 20 mph, what I will do is I will convey local concerns to Rachel and ask her to consider cushions with 20 mph, because if we don't do 20 mph, then we have to put humps ahead sign or cushions ahead signs on all roads. But whereas if we introduce 20 mph and cushion together, then we will not have to put those signs. So it will be sort of same cost, just slight additional cost of a TRO. So I will request Rachel to consider both at a time.
Yeah, I think so. The overwhelming strength of feeling that I have received is that those two things together would make a huge difference. I'm just going to publish some of these.
Also, can I start? Is Rednal Road is a bus route or not?
I think part of it is yes, or is all of it? Let me just think of something. It definitely is a top end by the school in the sort of West Heath side of it. I'm just trying to think where the bus pulls off. Where does it turn?
I haven't seen any bus on that, so I wasn't sure about that.
The bit outside the kind of the surgery is definitely a bus zone, because I run past there and there's a bus stop there. And then it turns, no, so the bus turns going towards the green. The bus turns onto Varden Way there.
Yeah.
So the sort of the dip and then back up again. That bit isn't a bus lane. Yes, someone said that the 49. That's the 49 then that turns onto Varden. Right, let me just keep on top of these. And someone.
So I can get the bus map and I will email it to Rachel. So
Yes.
Because if it's a bus route, then we will have to go for 65 high cushions instead of 75.
Yeah.
So I will get it. I will request bus services to provide me a map, local map of bus routes, and that will be helpful.
Yes, that's really good. Thank you. Just to sort of shore up the point that was previously made, someone has said in the chat that cushions and 20 mile an hour would be fantastic, and I think that is the kind of overwhelming response here. Some more comments are there. Mending the footpaths in Meadow Hill. This is a matter of priority, not dangerous. We need this to be taken forward ASAP. I agree. Residents will now start to put pressure on officers. It's unacceptable delay. We're sorry, but not wait any longer. Again, apologies, Sajid, but I am inclined to agree with that. And I will take it further and try and get more of a time frame on this. There's also a comment here. Could we see the recommendation, see the work plan, please? Again, I want to have a meeting that is kind of dedicated to this to make sure that any work that that is carried out is up to the standard that all of you and all of us as local residents expect. So I would certainly be in favour of holding a meeting, as we were hoping to do today, to get the recommendations and the plan shown to people beforehand, because the one thing that we absolutely must avoid is a big body of work being carried out against the wishes of local people. So please do not have any concerns about that. We would definitely reconvene a meeting once there is a recommendation and a work plan in place. Carmel has said traffic is regularly diverted to Rednal Road from Redditch Road, which is a main arterial road. Therefore, is there not a case for it be made to be considered a main road? Again, something that I would agree with. It does certainly feels like a a main road most of the time. Again, comment, will Rachel come to community meetings, hear our concerns, should take them on board? Yes, is one thing that I've been pushing for. Again, was hoping for that to be today, but certainly next time. Someone has thanked you for coming today, Sajid, as well, says your work is very much appreciated. I know I feel like I email you constantly, Sajid, so thank you for always being very prompt to reply. Someone has said, will this work include filling in numerous large and deep potholes? That's a very good question. I don't know if you could have any clarity on that, Sajid, because I know that potholes generally would be Kia Highways who carries out the work. Would any remedial work that takes place on Rednal Road, would that be carried out by Kia?
Any pothole, etc., can be even like if resident can directly report it to Kia using Birmingham City Council's highways website, and if there's any, they can even write to me and I will report on their behalf to Kia. But at the moment, Kia has developed a schedule, a plan to do Cat 2 repair across the city because of the weather. Last couple of months was not good for roads, rains, and then freezing temperature, and that has led to a lot of potholes across the city. But they are doing a lot of work. Within this next month, we are going to close about 90 roads for the Cat 2 repair. So Kia is doing a lot of work in these days, but I can appreciate there are a lot of potholes. But if there's any, residents can directly write to me. They can go on BCC's website and highway section, and then they can report it to directly on that website, and Kia will go and repair them.
Yeah, absolutely. And just to further come in on that, if you do see any potholes, please do feel free to email pictures of them to me, or even just if you aren't able to send me a photo, then just let me know where they are. I'm always more than happy.
Just location will be helpful.
Yeah, that would be great. I'm trying to see if any more comments or questions are going to come in. But that was really helpful. Is there anything else that you wish to add at this stage, Sajid? Not to put you on the spot there, sorry.
Not at the moment, but what we will do is we will have a separate meeting with the project manager, and we will try to request her, and so that we can get some proposals ASAP. And when the proposals are ready, we will have to go through for consultation, because we cannot put any question or humps without consultation with residents. Yeah. Moreover, not only like with local residents, we have to advertise these proposals under Section 90A of Highway Act 1980. So there will be a wide consultation. So residents shouldn't worry that we will go and build without asking them or consulting them. Even 20 mph limit will require formal consultations. So we always engage residents in development of all these schemes, because their local knowledge is much better than our knowledge or our desk study. So when we do consult with residents, we get a lot of good feedback, and we use that feedback to redevelop our proposals and change our proposals so that it is win-win situation for both local residents and us. And we are happy if they are happy, and if they're not happy with any proposals, we will not be happy. So we will be involving residents and other emergency services, bus services. This is a standard procedure. We cannot develop and deliver a scheme without involving residents.
No, that's absolutely brilliant. That's I think that's a fantastic point to end on, is for everybody to be rest assured that you as local residents will be involved with this at every stage of the process, and I will absolutely make sure that that is the case no matter what, because as Sajid said then, if it doesn't work for you, then it doesn't work for anybody. You're the people who have to live literally on this road every day, or at least near it, or use it every day. So I won't be happy with any body of work that doesn't have approval from all of you. So I think on that point, Sajid, that is a good place to end that part of the meeting. So again, thank you. There are a lot of comments thanking you, Sajid, and I again just further reiterate thanks to you for coming along, and apologise for sending you so many emails. But yeah, that's really great. Thank you for just helping shine a light on what's going on with Rednal Road and ensuring that the work is going to take place. So to move on then, we have next on the agenda is just a community update, which I'm happy to keep quite brief. I thought it might be good for the councillors present, just to give a bit of an update on any community work that is going on, particularly at a time where I think people have really sort of refound their community spirit and pride in where they live, whether that's sort of using their exercise every day to walk around their local community, to kind of helping out through various support networks. And also this is an opportunity for you to post some more questions in the chat if you have any sort of questions that are relating to anything in our local area. If I can't answer them directly on the call right now, I will certainly get them looked into to report back to you later. So the only couple of things from me really is that the farmers market was back on Saturday, and that was really nice actually to see people, and all of the market organisers have done a fantastic job over the last few months, making it more sort of COVID friendly, and having barriers in the right places and a one-way system, which can be stressful for a team of volunteers at times, but it was nice to sort of get back out there and chat to local residents. And again, that is on the second Saturday of every month. All of the traders are local, so if you do want to go out and support local businesses, that's a great opportunity to do it. I think all businesses across the city are struggling right now, but our kind of independent traders are the ones who need our support the most. So hopefully next month I will see you all there again, and just as the weather's getting better as well, so that's good. Just to give a very brief update on St Nicholas Place, as well as regular sort of attendees to these meetings will know that it was under threat of closure. I spoke to a couple of members of the Friends of Historic Kings Norton the other day who have kind of implied that things are far more positive than they were this time last year. Last year there were severe concerns that when the centre closed due to the lockdown beginning, that it may not reopen. But it is currently being used as Northfield Community Partnership's main food bank in the constituency. And if you want to donate any food, you can do so by going to St Nicholas Place between 9 and 2 any of the weekdays. But I understand that there are conversations ongoing about Northfield Community Partnership maybe taking a bit more of a role in the community centre, and hopefully keeping it more open as the restrictions are lifted. And again, I am going to be involved in those conversations and happy for us to feed back on that a little bit further down the line. I don't know, Peter, if you have anything that you want to add, if you've got any updates on your end in Kings Norton South, and again, if there are any comments or questions, then please do put them in the chat and we'll do our best to answer them. So if Peter, are you there? Sorry.
I think.
Hi.
Hi, Peter. If you could turn your camera on so people can see you as well, that'd be great, if possible.
Hi, Alex.
Hi, Peter. You're right.
I'm having some problems with. At the moment, I'm getting a delayed speech from the district engineer.
And yeah, that's typical of a virtual meeting. But yeah, if you want to, have you got any updates your end?
Yeah, I just wanted to mention fly tipping.
Mm-hmm.
We've had some success with clearing up.
Councillor, sounds like you are away from your Wi-Fi. You need to get a bit close to your Wi-Fi for better signal so that we can all hear you.
Are you there, Peter?
Some sort of Wi-Fi connection problem.
Yeah, no, I'm afraid we can't hear you, Peter. If you want to jump back in again at any point, just start speaking, or if you wanted to put a comment in the chat so people can hear. Oh, there we go. Have we got you now, Peter?
I'm still getting this.
Yeah, you mentioned fly tipping.
Yes, we've had a success with the Heath Park entrance being cleared up. And leave some heavy fly tipping old lines has been dealt with. There's still lots of referrals thought about it. We'll be sending those through either to the fly tipping team or to the neighbourhoods caretakers team as appropriate. I did want to mention the planning application for 107 Rednal Road.
Oh, yes.
That's your patch.
Mm-hmm.
Good back from the King's Lodge my patch.
Oh, sorry.
The application was refused by the committee. We're still waiting to hear with the concern.
Yeah, so I think Peter was breaking up a little bit there, but I think what he was saying is that the planning application for 107 Rednal Road is the centre of attention today. There had been a number of concerns from people who live around the Rednal Road area that this planning application wasn't acceptable, and also there were concerns that the developers were going above and beyond what they were actually applying for. So the most recent update on that was that it was rejected by the committee for about the 4th or 5th time now, I think. Isn't that right, Peter? And again, we'll keep on top of it and try and publicise it as much as possible when inevitably another planning application will probably go in, because they have tried about 4 or 5 times now. And have been rejected on a number of occasions. There is a comment in the chat. The service at Lifford Lane has been excellent during lockdown. I will totally agree with that. As someone who got quite obsessive about clearing out cupboards and under beds and in wardrobes during lockdown, I felt like I was there all the time. And so yeah, just a quick note to the staff at Lifford Lane, who have been absolutely fantastic. There's a comment here from Elizabeth that says, is there any chance of setting up a litter picking group? Masks are a problem. I know the nature reserve gets picked, but the roads aren't. Maybe we could adopt a road to pick. Absolutely agree with that. It's something I want to kind of do in the summer, is do this, have a kind of series of litter picking around both Kings Norton North and Kings Norton South, if Peter's happy to do that as well, which I imagine so, and get a good team of people on the ground, just making sure that Kings Norton continues to be a place that we're all extremely proud of. Is there anything else that you wish to add on that, Peter? Just to comment, I think that Kings Norton Nature Reserve has been a particular issue in the last couple of days. I did see the pictures on Facebook the other day that were appalling, and I've reported that, and I'm waiting to hear back. But hopefully one of the waste management team should get out there to sort that out, because it was appalling. But if you do hear of any instances of fly tipping, please do let us know, and we'll try and get it sorted as soon as possible. I don't think there are any other updates. So maybe you got anything else to add, Peter?
Just on the planning issue, people may like to be aware that
Yeah, have we lost you again, Peter? Peter, are you there?
yeah, just I'm getting feedback from you. Yes, I should. My camera is on. My camera is on. My camera's on. I can see myself very well.
Yeah, you are live now. If you want to just carry on what you're saying, we could hear you perfectly then.
Okay, I just wanted to add concerning planning. Yeah, I'm still getting a delay from you. I hope you can hear this. The planning approval was given for Gildas and Barrett's Road development, and that is the final planning approval. Outline of planning approval has been given for. I don't think that's possible.
Okay, yeah. Oh, thank you for that, Peter. Sorry that it seems that we are having some kind of connectivity issues there. So apologies, Peter, but I think you're saying about the Gildas Avenue planning application has been granted, which is very, very good news. And thank you for all of your work on that, Peter. So this is kind of final call really for any other questions or comments or anything you want to see on the next meeting. The next meeting I imagine will probably be around about the end of May time, or hopefully before, and that will probably be virtual. But as soon as we can have a physical meeting, then I would certainly like to get everybody in a room again. But we will ensure that on the next meeting, Rednal Road is kind of, again, front and centre, and an opportunity for officers who are overseeing the project to come and let us know what their proposals are, and also get your views on what those proposals should look like. So unless there is anything else from anyone else on the call, I think that is that for tonight. So thank you all. Oh, sorry, someone did ask about Redhill Road. Thank you for reminding me, Danetta. That's Redhill Road, not Rednal Road, but this might be one for you, Sajid, who I think is still on the call. Let me just find it, which is ask about the road safety on Redhill Road. There's still a lack of street lighting by Wast Hills training ground. We're concerned about the players leaving on dark evenings. Is this being addressed? Sajid, do you know anything about that, or is that something you can look into and then report back on at all?
I mean, on road, to the extent of public highway, we got adequate street lighting. But about the ground, I'm not sure. But if you drop me a line, I can get it investigated.
Yeah.
And if it falls in Slayer's Department of Parks, I can contact them on your behalf.
No, yeah, that's great. Thank you. I'll send you a quick note about that. And then if Danetta, if you want to email me, I'll put my email in the chat now. If you want to email me that, I will get that looked into, as will Sajid. Again, just looking at the final comments, someone has said the plea for food donations for the food bank at SMP. Yeah, just to reiterate what I said earlier, between 9 in the morning and 2 p.m. every day, if you have some food lying around, or if you want to get extra food with your shopping to help local people who are in need, that would be absolutely fantastic. So I think that is all. I hope you continue to stay safe and well, and that we are out of this sort of nightmarish time as soon as possible. As ever, email me if you ever need anything, and I look forward to seeing you all again very soon. Thank you, and thank you to everybody for attending today as well. Thank you, Sajid.
Thank you very much, and good night, everybody.
Thank you, and special thanks to Aidan tonight as well, who stepped in for Kay. Most of you know Kay is the one who usually oversees these meetings, but she is off on leave at the moment, so Aidan has stepped in for us. So thank you to Aidan as well.
Thank you, everybody. Cheers.
Thank you.
Bye. Bye.